Hello and welcome to Policy Watch by PolicyTV. I'm Miberon Omoluju. Now today, let's focus on something that happened recently in the health sector, and that is the issue of doctor strikes. Resident doctors across Nigeria began another nationwide strike on the 7th of April, but thankfully suspended it after reaching an understanding with the federal government on key demands. And the reason for the strike in the first place is not far-fetched. It is the same issue we keep hearing over and over again: unpaid salaries, unpaid allowances, and unfulfilled agreements. In fact, earlier this year, the Nigerian Association of Resident Doctors gave the government a 4-week ultimatum to fully implement agreements on salaries, allowances, and welfare. And they made it very clear, if nothing is done, they will withdraw their services. And this is where it becomes important to really understand what is going on beneath the surface. Because many people just hear doctors are on strike, but they don't fully understand why. Now let's talk about what doctors actually earn in Nigeria. A typical government-employed doctor in Nigeria earns roughly about 220,000 to 300,000 monthly as a medical officer, while resident doctors earn around 290,000 to 650,000 depending on their level. Now, on the surface level, that might sound okay, but here's the reality. These are professionals who work extremely long hours, handle life and death situations, and often work in very difficult conditions. And even more concerning, there have been reports where doctors received extremely low or irregular salaries due to deductions and unpaid arrears. In some shocking cases, doctors reportedly received as little as 27,000 naira or even less in certain months due to payroll issues and arrears. Now, imagine that. You go to work every day, you save lives, but your salary is either delayed, reduced, or not fully paid. Now, let's talk about the agreement that was supposed to fix this, because this is where the real issue is. The government and doctors had reached an agreement which included payment of salary arrears, payment of allowances like hazard and training allowances, implementation of an improved salary structure, and funding for residency training programs. In fact, the government even announced a 25 to 35% salary increase under the consolidated medical salary structure, which simply means the release of funds for training. But here's the problem. Doctors say these agreements were not fully implemented, some payments were delayed, some allowances were not paid, and some promises were only partially fulfilled. So what we are seeing now is the result of accumulated frustration over time. Now let's bring this back to the everyday Nigerian, because if doctors go on strike, the people who will suffer the most are Nigerians. Hospitals reduce service or shut down, patients are forced to turn to private hospitals, and those who cannot afford it are left stranded. And this is the painful part, because healthcare is not something you can just postpone. Now, the big question is, how do we fix this? Nigeria needs to establish a legally binding healthcare workforce agreement system that is automatically enforced, not something that is renegotiated every time. Right now, what we have is a cycle. Agreement is made, not fully implemented, doctors protest, strike happens, new agreement is made, and then the cycle repeats. That cycle has to stop. So instead of relying on promises, there should be a system backed by the law and technology where salaries and allowances are automatically released on schedule, budget allocations for health workers are protected, payments are tracked transparently, and once an agreement is signed, it becomes enforceable. In simple terms, if the government commits to pay something, it should not depend on reminders, protests, or strikes before it is done. Because once doctors are paid consistently, once working conditions improve, and once agreements are honored, the need for strikes will naturally reduce. And when that happens, hospitals will function more reliably and patients will get consistent care. Now, this isn't just about doctors. It's about a system that millions of Nigerians depend on. And until we fix that system, we'll keep coming back here. Same issue, different year. I'm Miberon Omoluju, and this has been Policy Watch by PolicyTV. Thank you for watching.